Good morning, everyone. So after Ajay sir's hilarious, important and very, very encroaching kind of a topic, I have one topic which I don't know whether you all want to hear or you all want to skip only altogether. कि ये सुनना ही नहीं है, जानना ही नहीं है, इसके बारे में हमको experience भी नहीं करना है. But I think as doctors in the present scenario, हम लोगों के पास ज़्यादा option है नहीं. This is going to happen and all of us are going to face the music someday. It's better to be equipped to face the music rather than look at it as something new. So good morning, everyone. We'll just try to touch this topic. Just one second. Basically, it's not working. Can someone help me, please? Or you want me to do it with the mouse? Okay. So all of us are used to this, that learning from our own mistakes is what our teachers taught us. Ki you do your mistakes and you learn from them, so there is no problem. This is a very ordinary learning that all of us have from our school and college days. But the times have changed today. हमारे पूरे जो tenure होते हैं practice के, I don't think हमारे पास इतना time है कि we do all the mistakes and learn from them. So it's much better to learn from others' mistakes, and that would be an extraordinary thing. I guess all these kinds of CMEs where we look into the cases, we look into the different scenarios, we face them some or the other time, and we have a lesson to learn from the previous experiences. So let's try to learn from others' experiences. So all of us know nothing travels faster than the speed of light. Physics में हमने सब 11-12 तक तो पढ़ा है. But I think there is an exception. Something that travels faster than light? Sorry? Bad news, exactly so. So bad news, it has its own special law, and that is what actually catches the speed. So we all know this is one case with Dr. Senthil, wherein there was a patient who came in with an acute abdomen, vomiting, went to a number of hospitals, reached this doctor at a very acute stage. When they saw the sonography, there were multiple calculi, posted for a surgery, DG stent done, post-surgery patient was fine, post-op care taken. Next day of the surgery, in the night at 9:15, suddenly the patient started having difficulty in breathing, shifted to the ICU, supports given, but the patient expired. Once the patient expired, it was declared as criminal negligence. A case was filed as criminal negligence. And when the body has gone for the postmortem doctors have said there is injury to the kidney because of which the patient had an MI and the patient died. So the doctor has to be caught in a criminal case. Now after that, there was a second opinion again taken by a bench of 3 doctors. So when that bench saw, they said, and to add to this, something surprising was that a person from outside has done a videography of the postmortem when these doctors were conducting it. And the next bench was shown this videography, and they were asked to opine on it. And when they were opining on it, they said that the video, it was edited. It was only a 4-minute video which was showing the whole postmortem. And secondly, they said that the injury to the kidney may not be an injury. It was a clean wound. So that could be because of the surgery. And the patient has expired 30 hours after the surgery. So this should not be taken in a criminal way. And that is how this doctor escaped from the whole criminal thing. So as soon as we have sudden death in the hospital, immediately it is taken, doctor का कुछ गलती हो गया, doctor has not done, त्यांना यायला पाहिजे होतं, आम्ही त्यांना 4 वेळा बोलवलं, पण कोणीच आलं नाही बघायला. That is the commonest thing. So doctor is the criminal. So that is the reason why we need to understand how do we deal with these situations, because it can come anytime. You need not be wrong. MI है patient को. What can you do? Suddenly, you can't do anything. Embolus हो गया patient को, you can't do anything. So in those cases, how do we deal with this situation? If there is a death in the hospital, then the relatives give the first reaction, right? And it's natural. It's natural. So first they will show anger. Then immediately they will come, give me an explanation. हे कसं झालं डॉक्टर? तुम्ही म्हणालात आमचा पेशंट चांगला आहे, घरी जाईल. मग कसं काय झालं? Next, there are some strong men who says, हमारा पेशेंट तो गया, जितना पैसा भरा वापस दे दो. So look at financial waivers. There are some other who will say, माझं पोलीसमध्ये खूपच ओळख आहे, ते आत्ता येतील, ॲक्शन घेतील. So again we have to deal with that. We all know violence, verbal and physical, both. And again, there is a lot of intervention by political parties, by politicians, by journalists, by media, a lot of things. So the doctor has to deal not only with the patient and the relatives, but has to deal with all these things. The first thing you need to do is sit back and think before you react. Do not react. That is the first thing you need to do. So we all know that the task of breaking a bad news, if we do it badly, the patient and the family relatives will never forgive us. May not be for the news, but even for the attitude with which we do it. And if we do it well, they may never forget us. So immaterial of the news, it is the way you deliver the news that really matters. So how do we prevent medico-legal issues in our day-to-day practices? That's most important. First is communication. Have our communication very good. Most important, communication is not talking. Communication is not giving information. Communication has to be an effective communication. That means the person understands what you are talking in the way you are talking. It is the perception in the same way. If I'm trying to tell you something and you're understanding it in a different way, it doesn't make sense. That is not communication. So we need to understand. मैंने तो सब बताया था, हमने तो बताया था, लेकिन सामने वाले ने समझा क्या? That's more important. So we need to understand that we are talking to the patient in their language, in their understandability. It's not showing your knowledge. It is making them understand. The next is documentation, documentation, documentation. As I said, already said that. And the third most important thing is training and education, which is a constant ongoing thing. एक दिन में कोई पढ़ नहीं सकता. We've all taken so many years to be here. So it has to be a very constant process. This is not only for doctors, it is even for your paramedic staffs. It is for your mamas, your maushis, your staffs, because we all work with a lot of compromised paramedical staff. So we need to be very careful about it. Now, as a doctor, what should we do in such a situation? First, call our colleagues and friends. Do not think twice. वो मेरे बारे में क्या सोचेगा? तुमचा फ्रेंड काहीच विचार करणार नाही. आणि दुसरी गोष्ट, तुम्ही आज ज्या सिच्युएशनमध्ये आहात तेव्हा कोणी ना कोणी दुसरं पण त्या सिच्युएशनमध्ये येणार आहे. तर ह्याच्यात काही लपवण्यासारखं नाही आहे. कॉल देम फॉर हेल्प. टास्क फोर्स ऑन अ प्लॅटफॉर्म. जेव्हा तुम्ही कम्युनिकेट करताय, सी टू इट की सगळ्या सिनियर्स, ओळखीचे, डॉक्टर्स, आपले जेवढी ग्रुप आहे त्यांना एकत्र घ्या आणि एकत्र बोला. इफ रिक्वायर्ड कॉल द पुलिस. राइट अवे पुलिस को बुलाना ज़रूरी नहीं है. नो रिपीटेड एक्सप्लेनेटरी स्टेटमेंट्स. खूप वेळा काय असते, नाही ओ मी हे केलं ते केलं ते केलं, मग ह्या आला ह्याला सांगायचं, तो आला त्याला सांगायचं. नॉट नेसेसरी. एकदा तुम्ही सांगितलं इट्स इनफ. इन्व्हॉल्व ओनली रिस्पॉन्सिबल पर्सन्स. म्हणजे आता काही कॉम्प्लिकेशन झाल्यानंतर बाजूवाले ॲक्टिव्ह होतात, मग समोरच्या बिल्डिंगवाले ॲक्टिव्ह होतात. सगळ्यांना उत्तरं देण्याची काहीच गरज नाही आहे. टॉक टू रिस्पॉन्सिबल पीपल. Be a patient listener. There is one point of time where the patient's relatives only want you to listen to them. So we need to listen at that time. And again, documentation. Documentation मेरे talk में बहुत बार आएगा. You understand how important it is कि इतने बार मैं repeat कर रही हूँ. Next is medico-legal cases and other situations also. Postmortem is a must. In fact, if we are talking about a 24 hours death within 24 hours, ideally, you should ask for a postmortem until and unless you are very sure of the cause of death. So what to do before declaring dead? First is you continue the treatment. If the patient is in the ward and suddenly something happens, the first thing is split your hospital staff into two. एक staff patient के साथ रहेगा. Staff यानी एक group patient के साथ रहेगा. One group will go to the reception place. So what happens is you can tell this very nicely, tell the relatives and all the attendants, please come out or move the patient into another room. Please do not try to do gimmicks in front of the relatives. Complete the documentation. That's very important. Do not try to do anything before that. Preserve all the empty vials and syringes that you have used for this patient. And collect blood and keep in a plain bulb, EDTA bulb and sugar bulb. Whether you need it or not is a later thing. Keep it. Also, excellence in medical documentation reflects and creates excellence in medical care. See, documentation is that medical condition of the patient which you are conveying. What you have done, very few people have seen. What you have written, everybody reads, even in the court. Number of times all of us give CPR to the patient for 20 minutes, 40 minutes, 50 minutes. And how many notes are written? 2, 3. Why? We are trying so much for the patient. Mention that on paper, because what you have mentioned in paper is the effort that you have put. See to it that 5 minutes, 10 minutes, all your notes are written, and as many people are contributing to your effort, let them put their notes. Let them know there was a team fighting for the patient. Negligence is not when you lose the patient. Negligence is when you have not tried to save the patient. So that you have to prove that I have tried to save this patient. Always remember, poor documentation can make a good care look bad. So your documentation you have to particularly take care about. Now, in which conditions do we inform the police? If there is a fall from the bed in the hospital or in the toilet, if there's an anaphylactic reaction, there's a post-procedure death, if there's death due to bleeding or DIC, if there's a maternal mortality. Of course, other than this, also when there are deaths due to your medico-legal cases, road traffic accidents, poisoning, all these cases you will report. Next is, if we look at the practical key points, what do we do? Aa gaya problem, we are dealing with it, but what do we do? More important, have your emergency tray and staff ready 24/7, 365 days. And in this tray, see to it that there are no expiry drugs. Please keep updating the tray. That's very important. And in the tray, when you're setting the vials, be very careful. Many vials look alike. Atropine, adrenaline. When our staff is in a little hurry-burry, they tend to just pick something and give because you're screaming. So label it and keep it in different places so that they do not mistake the medicines for each other. The next is, have a trained staff who will work like a spokesman. A staff, a doctor, anybody. Somebody who knows how to communicate to people during the time of crisis. You cannot be doing everything. You can either be trying for the patient, you may be communicating, or you may be talking. Ideally, do not talk in the first tense because you are not in that mental status to talk. Wait back. Don't try, if there is an OT death, don't try to change the scenario of the OT, make it clean. No, you have tried for the patient, let it be that way. And also see that the spokesman first gives the news. And when he is giving the news, you are still trying. Not saying that we've lost the patient, saying that we are trying to save the patient, but there is an issue. Make it very clear. There's nothing to hide. Next is your documentation, which you're supposed to do very, very clearly and very neatly. Many a times doctors in crisis or non-crisis always scribble their notes. Please see to it, according to the Medical Code of Ethics, we are supposed to write in a very legible handwriting, and doctors are being punished by the court for writing in an illegible handwriting, even the injury certificates. So we have to be writing in a very legible handwriting. And we have to train a person in our hospital also to do the documentation, even if we are taking help from other doctors to do the same. In this whole scenario, the take-home messages that I would like to give is, don't be in a hurry to declare death. Personally be ready for it and make the relatives and the environment a little settled to declare. Next is, take help from your colleagues. Please call, have a good number of doctors standing by your side. Communicate the progress and also tell them the effort that you are putting on a constant basis. Like every 5 minutes you say, I'm doing it but not responding, I'm doing it, you're not responding. During this time, you know the patients are getting agitated. Make it known that there is a CCTV which is recording everything. At that time, it can be a reason to avoid physical violence in your hospital. Dealing with it later is different, but the losses you will have to bear. Keep a discharge cum death summary ready in duplicate. And when you're handing it over, take the signature, take the receiving, and have 2 neutral witnesses saying that you have handed over this document. You still have time to complete your documents. Always better complete it at the earliest date. Do not try to sit over it that I have 48 hours, I have 72 hours. No. Finish it off on the spot, because the things that you remember right now, you will not remember later. You will forget about it and you will not mention. So thank you so much for a very patient hearing, and I would like to thank all of you, my medico-legal IMA cell, President Sir, all the dignitaries here, and of course IMA NANDED for having me here. It was a pleasure being with all of you. I hope these few statements would be of some use in your day-to-day practices. Thank you so much.